Today we're going to talk about treatment planning and especially our way of utilizing the SAC tool in clinical practice.
Imagine if you could approach every implant case with total confidence, knowing exactly how to assess, plan, and execute for the best possible outcome. Thank you for joining us.
So here we go. Implantology, not that hard, right? You'll only have to select the right kind of implant for the right kind of patient to an optimal tissue situation and place the implant in a correct position. Then you'll have to use appropriate components and suitable materials to a well-designed, beautiful and durable prosthetic restoration. Have a design that will be maintainable by the patient and have the patient know the patient's role in keeping the implant and the restoration intact for a multitude of years. So that's easy, right? Implantology can be made look really simple, and in many cases it is. We have surgical steps, and then we have prosthodontic steps in order to regain the tooth that was once lost, the function and the aesthetics, and then we'll have beautiful pictures after a couple of years of function where everything is still in place and working as it's brand new. Technology has gone forward quite a lot, and as said, many cases are simple, but there are so many things to be taken into consideration when planning an implant treatment, and it's easy to overlook some risks if you're not methodical in your examination and treatment planning steps. First of all, we'll have to bear in mind that implant is an abutment for a prosthetic structure. In prosthodontic planning, our goal of treatment is always to restore the masticatory function and to mimic the natural aesthetics in replacing the missing teeth and tissues. Our goal of treatment is never placing implants. However, if we have lost a tooth or we have a tooth that is with a poor prognosis, implants are often a very good option for the treatment. So what is needed in order to have successful osseointegration and successful implant treatments? We need good quality and quantity of bone. We need good soft tissues. We need to choose the right kind of implant. We'll need to have a proper surgical technique and timing. We'll have to use a proper loading protocol and then have the prosthodontic design and materials and managing the transmucosal complex in a proper manner. And then we'll have to bear in mind that it's always the patient who has the restoration in the mouth. So we'll have to make sure that the patient knows what is required of the patient and the self-maintenance care. So in order to create a natural aesthetics and function, the critical part of the restoration is the transmucosal complex. How do we go from implant level to the crown? Obviously, the crown has to look natural and good, but for the longevity of the implant, the transmucosal complex is key. We have a lot of good publication on this subject coming out now, and this is one of the very good ones from Nikos Mateos and Martin Janda and the group. We'll need to have soft tissue height. We'll need to have the proper emergence profile and angle. We'll have to choose the implant either from tissue level or bone level. And then if we do bone level, we need to control the emergence angle properly. We'll need to have good access for oral hygiene. We need to consider the materials that are most suitable for the restoration. We need to plan the junctions right and have them executed in a manner that is cleansable, and then have the retention type chosen, preferably screw retained. There was a great webinar from German Gallucci just recently on EPA, and I especially like this quote from him, where we don't plan implants, we should plan implant prosthetic complexes that are biologically, mechanically, and aesthetically integrated, stable long-term, and with least re-interventions. But when it comes to treatment planning, we'll have to know that the gingival architecture and how the gingival margin is. We'll need to have good implant position, enough soft tissue height as mentioned, and then we need to control that shape and form with our restorations. So we need to know what's there in the soft tissue in the transmucal complex area, what zones are there, what kind of shapes we can use in which area, and how does the patient's initial situation correlate to those demands we'll have for the end result. Survival isn't the only success criteria, and as techniques, materials have evolved so much during the past years, aesthetic considerations and demand from the patients is getting higher all the time. In treatment planning, we know that survival rate of implants in 10-year spectrum is very high. It's somewhere around 95 to 98% depending on the source. But we do have problems as well. We'll have biological problems, naming peri-implant mucositis and peri-implantitis, and then we'll have technical and mechanical complications. We also know that the professionals themselves are hugely responsible of successes but also failures. And the failures tend to accumulate. If we don't monitor our work, we might do a lot, but we never know how we're actually doing. 5 years, everything should work 5 years without a problem. If it doesn't work for 5 years, then it's very poor treatment planning or execution or both. And as digital dentistry is making the prosthetic steps especially very easy, but also the implant placement protocols and the development on that side has gone forward. Implantology is in a way straightforward when you're thinking only the procedures. The one thing that is hard is to know enough of where the risks are and how to manage them. And that's the key. That's the key in treatment planning, risk management, and knowledging the risks. In order to do that, we'll need to have a proper baseline mapping.